Tony, would you like to introduce our speakers, please?
Yes, I'd be honored to introduce them. The first one is Ron Matheson. He's on the top right corner of my screen. But he's the guy with the vertical blinds behind his head.
Yeah.
Ron is the Director of Fund Development and Spiritual Life here at Shepherd Village, and he's responsible for a lot of the fundraising that's used to enhance the lives of the seniors here at Shepherd Village, and Wendy will tell you more about that later. And he's also in charge of the spiritual life activities at Shepherd Village Church, of which I'm the pastor, and all of the resident community. So Ron, I report directly to Ron. He's my boss. He's the slave driver I mentioned. No, he's not. He's okay. He's a good guy. Yeah. The other thing about Ron, he's got an extensive ministry background. Like me, he's an ordained minister with the Pentecostal Assemblies of Canada. And we have something else very much in common. We both ride Harleys. So it can't be all bad, right? Well, that's my friend Ron.
Nice
so the next person I would like to introduce is our President and CEO, Wendy Beckles. Wendy is now Shepherd Village. She's going to tell you is one of the largest integrated single-site seniors communities in Ontario. Wendy's a graduate of Harvard University and the Rotman School of Management. She's got almost 3 decades of experience in financial management and executive leadership. Her accreditations include Certified General Accounting, Chartered Professional Accounting, and Certified Healthcare Administrator. She sits on several committees, including the Ontario Long-Term Care Association, the Central East Local Health Integration Network for Nonprofit Long-Term Care CEO Alliance Group, and the Seniors Campuses Advisor Group of the University of Toronto. In addition to healthcare, Wendy has diversified professional experience across other sectors, including oil and gas, nonprofit, and finance. And as Gordon said when he read Wendy's resume, what a great candidate for Rotary. So my honor to introduce Wendy Beckles to you, my ultimate boss and president. Thank you.
Thank you, Tony.
So you're up, Wendy, I think.
All right. Wow.
Are you going to mute the rest of us, Gordon? Gordon must be on mute himself.
Yeah, everybody's on mute.
I think I muted everybody. So.
Okay, wonderful. Well, it is a pleasure.
Sorry, if you're not on mute, please do so. Thank you.
Okay, well, it is an absolute pleasure to be with you in this Zoom forum, which has become our new normal meeting settings. And to have the opportunity just to share a little bit about Shepherd Village. I don't know how much you know about Shepherd Village, but I've been president and CEO for just about 4 years now, and it's a wonderful place. And we have our vision, which is to be a continuum of care in a Christian community where seniors find peace of mind, and that is a very huge vision. We then focus in terms of a mission, and we're associated with the Pentecostal Assemblies of Canada, and our mission is to meet the changing physical, spiritual, and social needs of seniors through quality care and compassionate service. And we believe in our values and try to emulate them in what we do, from frontline right up to senior managers. And our values spell the word care. So we've got compassionate care, we've got accountability, respect, and excellence. And these are things that we don't just put on signage around the building, but we do practice in our ongoing activities across the village. We've been around for just about 60 years now, and we are home to about 900 seniors. We've got long-term care, which is about 250, and retirement assisted living is about 150. and the other 600 plus residents are in our life lease condos and independent apartments. So it's quite the village, and recently actually we did an assessment of our strengths, our challenges, opportunities and threats, and we were really pleased to see the top strengths that folk identified were around our leadership team, the teamwork at the village, our Christian identity and values, being a central location for folk was named as a strength, our continuum of care services, and of course a good reputation in the industry, organizational flexibility, which is something that really came to the fore during this pandemic, and of course the wide range of programs and services. We do face challenges, the increasing costs of infrastructure, maintenance and operations, those kind of things, retention, recruitment of staff, especially our frontline staff. Again, over the pandemic, this has really been a point of concern for us. Maintaining full occupancy, these are challenges that have been identified. And one of the key opportunities is developing external partnerships with the community. And that's what we're hoping to do with this Rotary connection, because it is important that we have these connections with organizations who have similar values and a similar mission. We're looking to serve seniors, and I can see from the great community work of the Rotary that there are some similarities there in our wanting to be helpful in the time that we have, the opportunity that we've been given, the resources that we've been blessed with, to have an opportunity to make a difference, to whether it's empower people or to just help them progress a little further along in life in general. And so we come alongside seniors. I can see Rotary also comes alongside youth and other demographics also. And again, just to give you a little glimpse of what Shepherd Village has looked like over the course of COVID, as I mentioned, one of our values being compassionate care, we as a team are genuinely concerned about the well-being of those we serve. And so COVID-19 tested us to the limit and continues to test us. And so as a team, we engaged in proactive planning and implemented procedures well before government directives were issued. That advanced planning and preparation is definitely what gave us a leg up. We are happy to say that Shepherd Village was one of the sites who didn't have active COVID during wave 1. And so we are working again through wave 2, but it is an invisible enemy that we face. And so it has really been something that has stretched us. We met frequently as a pandemic team during the course of this pandemic. And the idea was to effectively and efficiently put things in place that would address the constant changes coming to us as a result of the pandemic. And village life looks considerably different. We are usually a vibrant village where people interact. We're always out and about. But you had a considerably different look with the community hall, the group festivities, the church services, the congregate dining, town halls, volunteer appreciation, staff celebrations. Everything was either canceled or modified to an online forum like the one we're having today, with socially distanced and masked faces. So it wasn't your warm, welcoming village that we've been used to, but we've made it through. And in many ways, COVID highlighted the trust factor between management, staff, residents, families, and the essential service providers. And for our health and safety, we relied on each other, being both responsible for and accountable to each other. So we found that teamwork really played an important role in us making it through wave 2. And finally, lessons learned and best practices developed from our activities and relationship with alliance groups, the long-term care, the retirement homes across the GTA have equipped us to face the next wave of the pandemic. And so we are confidently going forward. And whatever that new normal looks like, we know that community partners are going to play a key role as we plan our course for the future. We are also currently in our strategic planning process for the next 5 years, so 2021 through to 2025. And so we are looking for new avenues to partner with organizations to just advance the mission of the organization and relationships that will also benefit the organization that we will partner with. So I'm actually going to punt the ball over to Ron, who is going to share a bit more on our fund development activities to date.
Hi again. Thank you, Wendy. And I've been at Shepherd Village since January of 2009. My responsibilities are twofold. I oversee the spiritual life as well as the fund development. And we've had 2 pastors and a full-time chaplain here. So we do have a really vibrant spiritual life program. And that spiritual life program, as you're aware of, usually would take place in community gatherings with a lot of volunteers assisting our staff and our chaplains and our pastors. But it would also be in the church, in the heart of the village here. There is an actual church made up of the congregation of the people from the village, from the apartments, the life lease, the retirement assisted living, as well as the long-term care. And so usually on a Sunday morning, Sunday night, Friday night, Thursday night, and Wednesday night, and during the day on Mondays, Tuesdays, and every day of the week, there's some kind of a spiritual life program that's happening. During the time of isolation and COVID, we've had to restrict that for obvious reasons, and the care of and the safety of our residents here and tenants at Shepherd Village is primary importance to us. So we've had to stop the community gatherings. Then when we were allowed to come back a little bit with social distancing and allowing us to use 30% of capacity in terms of seating, we were able to bring a shorter or a smaller number of people together. Tony's been helping us do that. That's on a week-to-week basis in terms of what's happening around the village. We've been very fortunate in that we, as Wendy said, we haven't had major outbreaks as many of them have. And our residents have been sort of in a village bubble. So if you think of 800 to 900 people in a small community, that's sort of Shepherd Village with a lot of the amenities on site here. So we have been able to introduce some of that. But what we've relied on very much is our streaming it. We've streamed live throughout the community. Rogers had installed a few years ago an analog system that our residents could access on their televisions, which would be on channel 988 internally. There are some challenges with that, and that's one of the reasons why that we've been talking to you, and I think Tony shared with you some of our need that way, is that our camera system, when people are able to gather, usually we aren't so worried about the performance of the camera. You have one bad week where you're sitting at home watching on television, and you can't zoom in as well. Then the next week you can be at the service. Well, that doesn't happen at this point. So we need to be able to stream a better camera system that will engage not only that, but the music that's happening. And if we're showing a film on our backdrop there, we would like them to be able to see it crisply and to be able to access that. So that's one of the challenges that we have found, and going forward for us, we want to install a better camera, better sound system, and more of a digital system that will help us that will integrate with the analog, but also digital, that'll take us down the road. Because one of the big projects that we have found is a real challenge for not only Shepherd Village, but I would think a lot of other communities like ours, is connecting families with their loved ones. And we know that if family members are just coming in without the safeguards that are put in place because of the nature of COVID, it's just not safe. And so family members don't want to be coming and visiting and putting their loved one at risk. What they want to do is be able to connect and communicate with them from off-site. And we're looking for virtual ways to do that. And we're talking about a fairly major project going forward, in that we can find a way to sort of live stream every one of the rooms, and or at least the floors, and as well as the independent buildings, so that there's a better communication system set up. That's probably a good 5 to 10 year project going forward. But the base of that would be a camera system. That's not a huge expense, but it is important to what we're trying to do. So our projects are really to enhance the life of a resident. They're primary in what we do here. So the memorial gardens that we have around here, if you haven't had a chance, once this cloud of COVID lifts, I would love to have you all come on site and give you a tour. Not going to do it right now. It wouldn't be safe for you, for the residents especially, and nobody's doing that. But when that does, I'd love to give you a walk around, introduce you to the memorial gardens, the therapeutic gardens that we've developed, and we've been developing that on a yearly basis. We also put in lifts and new electric beds that help the resident. They can use the remote themselves. What people don't realize is the government can't and doesn't fund all of these things. And the operation costs are so significant, and especially at a time like this, that we do fundraising to help us do the things that are the extras, that take us to an extra level of comfort and enhancement to the residents. That's my role here. And we have a lot of different things. We actually ran a special event with Chef Michael Smith, a fundraiser that you would have loved to have been a part of. He's one of Canada's favorite chefs. He's just a little guy, 6'7", and he fills up a room with his presence. And so we did a great event where we went from each of the buildings with food stations, and we had music in every one of those stations. We did it as a fundraiser to help us raise the funds for the beds and the lifts in the lodge, which also helped the staff in terms of the work that they're doing. That's the kind of thing we were hoping to do again this year. That got curtailed, and we were able to do our golf tournament. We do an annual golf tournament, and we did it differently this year, obviously. We didn't have a big banquet at the end of it. We usually fill out with 140 golfers. This year we had, I believe it was about 115, and we raised about $78,000 and probably about 50,000 net, which again helped us this year with the costs of our personal protective equipment, the PPE costs this year, and the staffing costs, and additional costs of cleaning for COVID and safety of our residents, and that has just gone through the roof. It's unbelievable the kind of costs that we're incurring. So that's my role here. And because of the isolation, Tony stands there on a Sunday morning and speaks into a camera that does the best that it can. And I won't comment, Tony, about what they've got to work with, because he's a good-looking guy, isn't he? I mean, we can agree. It's not Tony, it's the camera. So, but we would like to have a camera that will give us a little bit better what we're doing. Maybe even Tony, you might want to address a couple of those needs that way as well. I'll just stop and let Tony, if you want to add anything with that, or Wendy, I'll mute myself for a little bit, and then we can take some questions as well.
Just to go further on what Ron is saying, he's in charge of spiritual life and fundraising, but I'm really the spiritual life side of that for all of the residents. This is a predominantly Christian community. There's still many non-Christians, but that's fine. We try to integrate them as well. But it's predominantly the majority of people are Christian, and they just yearn for the fellowship of one from another. You know what it's like if you're not been in church and you miss your friends. There's been such a terrible tragedy of loneliness and isolation for most of these residents that have not been able to come into their church community, not be able to fellowship with one another. And we know, and medical practitioners will tell you, that a person's spiritual life has a corresponding effect on their mental and physical life. And spiritual life is an enhancement to us. It's an encouragement to us, and they're missing their spiritual growth. They're missing this spiritual part of their lives that they found so essential. Now, the camera system that we have right now, yes, I do stand in front of a camera on a Sunday morning, and that goes through an analog system connected to that channel that Ron mentioned, 988. But unfortunately, 988 is an old technology, and if anybody's got any new Rogers things like Rogers Ignite, I think they call it, or they don't have Rogers, they have Bell, or they maybe don't have that at all. So we're estimating probably it's only a fraction of the residents that it's reaching right now with this analog system. So the rest of the residents aren't getting it, and they can't. And they ask me, "What? Can we not get it? Why can't we get it?" And so with a digital system, the camera that we're trying to get put in here, it's a very, very inexpensive system compared to what I thought. I thought it was going to be in the tens of thousands, but we got a good vendor to give us a quote where we will put this digital camera in the chapel here, and I can talk on that, or we can do all of our services, and it goes directly digitally. We can live stream it right on YouTube or on Facebook, live stream. And anybody with internet, they've got a phone or a notepad that they have internet with on YouTube, they can watch us right there on YouTube. And it's all recorded as well. And so they're going to have that connection. And not only that, it goes beyond that, as Ron said. This is just this sort of the genesis of getting virtual connection to all of our residents with their loved ones and family. This is just a start. So that's really what we're trying to do, is allow them to, well, they can't mingle together at least, and especially, it's not so much the people in the independent living. It's the people that are in Shepherd Lodge and Shepherd Terrace. They are totally restricted. They're totally cut off from everybody else. They can't come anywhere near the independent living residents. They're the ones that are perhaps suffering more than anything. A lot of those poor people, especially in the lodge, don't see their loved ones. They don't see any family. Many of them are suffering from dementia. And I know when I go in there usually on a Thursday to do a little devotional with some of them. And as I go in and do this devotional, and I will play some music for them, some Christian songs and hymns. And as I'm playing those songs and those hymns, and I'm singing, I see their lips moving as they are mouthing the words to the songs. Even though they have dementia, they know those songs because they were there in their youth, and music just is a wonderful thing for them. So but they're so hurting, and I want to be able to provide them with more interaction so they can watch our church services. They can listen to the singing. I have to sing on Sundays too, by the way. I can't. We have a musician, but I have to do the singing as well. Yes, I don't have a bad voice, Gordon. It's not that bad. But there's a desperate need to connect so that they have that sense of belonging that they're missing. They have that sense of coming together instead of the isolation. My heart goes out to them. We're all going to get there one day. Many of you are close to it. I'm close. And we're all going to, and we need to take care of our senior people. We need to really, people have given their lives to our country, given their lives to our cities, and given their lives to everything, and now are suffering at the end of their years, feeling perhaps that nobody cares. But we do care, and we want to let them know that we care. So.
Okay, thank you. Thank you, Wendy. Thank you, Ron. Thank you, Tony. Anybody have any questions? Okay, good. I think your hand went up first.
Yes, thank you very much. That was all very interesting. I'm lucky that my mother is 90 years old, almost 90 years old. She lives at home, and she's totally fit, drives a car, and all these kind of things. Okay, I'm sorry, I have to take this. I'll be back later. Sorry.
Okay, Alan.
I don't know if it's for Wendy or Ron. From an operational standpoint, you have these different areas within the Shepherd Village, because I have been there before myself. There's a friend of ours that had her mother live there, but she lived in her own apartment. What about the COVID testing of staff and people that would come in and out of the building? What's the protocol on all that?
Okay, so thanks, Alan. Great question. We have a regimen in place where we test all of our staff twice a month. So it's every 2 weeks. And so that helps us keep track of at least the staffing component of our team. For those coming in as the essential visitors, we have them provide us with proof of their COVID test. And so the idea is to try to make sure that we are keeping track of, one, if there is any positive test, we do that immediate contact tracing, but also as a containment measure to make sure that if we do have that positive test, people are immediately sent home as staff, or public health does come in to play as well, and so they go into that period of isolation. But as I said when I was sharing earlier, it's an invisible enemy that we face. So the testing is huge, but also the speed with which we get those test results is also huge, because while you're waiting for results, you get a positive result today, you've been tested 3 or 4 days earlier, you've been contagious for 4 days and we didn't know. So the testing is something that we really push, and obviously we advocate for the speedy return of those test results.
Hey, David.
Hi, this is something, Wendy, the government's bringing in these quick test machines which can turn around in 15 minutes. And they've said they're going to deploy them to high-risk areas. Do you think that you may fall under that?
Actually, thanks, David. I sit on the provincial team. It's called the Planning and Recovery Table. And so we are aware of these 2 machines that Health Canada has approved. One of these machines will work in terms of our staff testing, because one of them is for the larger population of tests, a larger volume of tests. The results supposed to come back in 5 to 15 minutes. The other test is more in terms of if you have a positive case and you need to do immediate testing of the 3 to 10 people that or residents on the floor. And so that test is for that. So our hand is already up. We're already around the table. We do need to develop criteria around how this testing will roll out. They need the input and support from management, because you do need to make sure that there are strict protocols in place. And that the testing is going to be done by a health practitioner, much like what we do with the COVID testing now. But the test results is assessed right there on site. So you don't have to then collect the samples and send them to the lab. So we are looking forward to it. The only concern that we have is the rate of accuracy. And that is a huge concern for us. I mean, there is a traumatic response when you get a positive result. Not only does the individual go through that shock of, I'm positive, I could die, but everyone around then, there's that fear factor that happens. So you do not want a false positive in the environment, right? There's a lot of anxiety around that. And we have had false positives before. And what we're seeing now, and we had a doctor report at my board meeting last night, there are about up to 8 different strains now of coronavirus from COVID-19. So we're having people test positive that have no symptoms at all. A lot more of the asymptomatic people are testing positive, or someone that thinks they have a little shiver, and by the next day, they've taken a Tylenol or NyQuil, they sleep it off, they feel wonderful, but that person is still testing positive. So we have public health is around that planning table as well, and they are looking at redefining the criteria for outbreaks, because initially it was 1 positive and the entire building was put in outbreak. Now they're talking about 2 or more with active symptoms, before they consider outbreak. So the testing, it's definitely key, but we got to make sure we can get some kind of reliance on the results being accurate.
Okay. Arthur, you had a question?
Yeah, this is for either Wendy or Tony. This digital camera system that you're talking about, is this primarily for the church service and the sermon, or does it serve other purposes in general to communicate with the people in the Shepherd Village?
So, Tony, are you?
Yeah.
Okay.
Of course, if we get this camera in place, we'll be able to project any message to any of the residents, as long as they have some kind of a device to receive it by YouTube or Facebook. So no, it is not restricted to church services. Its primary use would be for church services, fellowship meetings, everything like that. But being as it's part and the heart of Shepherd Village, the camera is here to be used by any of our teams, any of our staff that want to get a general message out or want to, address certain things in certain areas. It's just the start of something new. I think that the whole world is going to be going virtual. I mean, we've seen from all this COVID stuff now and these Zoom meetings that virtual connections is becoming so normal that people are getting so used to it. And this is going to be, I say, the start. We will start in the chapel, and then hopefully we gain from that experience and move out beyond the chapel into corporate areas that Wendy would control. So no, not just for the chapel, not just for church services.
I got a second question. I did receive your email to President Gordon, and he sent it to me. I would like more details on the planning and what you want to do, so that a cost breakdown, if you may. I would like to receive one of that from you, Tony, if you can.
Sure, I'll send it to you. I'll send you the breakdown. Yeah.
Okay.
Yeah.
Thank you,
David, then Ron. Sorry, Ron.
Yeah. just to follow on the on this whole thing of the cameras and so on, are you proposing to replace the existing system that you have, which is cable based, or are you going to go to wireless or fiber? That's one of the things with an area like that, because I've been to Shepherd Village several times. It's a great facility, by the way. I try to get my folks in there, but my father won't do it. He's too independent. But yeah, it's so how would you propose to do this? What's the rollout going to be like?
Well, we would initially we would have to piggyback on the cable system, because not everybody has internet. Those that have cable system, we don't want to get rid of that. So we would piggyback on that by using some kind of it's a technological thing, a splitter, where you can split a digital into an analog and send it off in another direction. But down the road, of course, eventually we're hoping everything will become digital, everything would be streamed, everybody would have access through the internet, through Wi-Fi, no longer need of cables, because to hardwire is an extreme expense, extreme. We've looked at other communities that have done that, and the expense is just outlandish. So we think Wi-Fi is probably the best way to go. That's what we're thinking anyway.
Yeah. And if I could just add to what Tony's saying in terms of spreading it beyond the church. So we have already purchased a lot of tablets. So for wave one of this pandemic, we've had staff interact with the residents and families, connecting them on whether it was YouTube or Skype. So we've got several tablets, and we've just invested in a number of large televisions, which would give the large screen to facilitate the digital projections coming through. And we will have them strategically placed throughout the floors for the residents to be able to see the different streamed programs from Spiritual Life and other forms of messaging that, because I mean, Ron he will go every day almost to the PA system. So the same system that we announced the fire, Ron will start by saying, this is not an emergency. And then he gives just a little word of encouragement, and the staff are so appreciative of this. And as Tony says, the residents, especially in long-term care and retirement, they're on lockdown. And even our independent buildings, although it's not mandatory, we encourage them, please don't go out into the community, stay home. So to be able to stream this program and just a voice to say hello, how are you doing, just to share a word of encouragement with them. We've had a lot of great responses from the residents saying it's just been that breath of fresh air for them.
Okay, Ron, you had something to say, then we better wrap it up, I think.
Yeah, I think as Wendy mentioned, that PA system, the sound system that we use right now is for fire. And it is startling to the residents. It is something that we need to find a better way to do it. And but I've been overwhelmed with the response from both the residents and the staff in terms of the encouragement that they received from it. And it's as Wendy said, just that voice. It's important that we have on a daily basis, under normal circumstances, just reams of family members here and volunteers who are on site. During COVID, you can't do that. So our staff have been working overtime to connect families, and they do a phenomenal job. And they've been doing a phenomenal job with the recreation and our chaplains as well. And so they use those tablets to do that. So it's they are engaging the families, doing the best that they can. Our costs are absolutely huge, as I mentioned, with the PPE. We have because you don't know where this infection is at any time. Our staff wear their masks on an ongoing basis. And so every one of them are issued at least twice a day. So we have about 500, probably to 600-700 masks going out a day. and the cost of that alone is significant. So there are costs, and if it was something that you said, you know what, we're not necessarily feeling that we would like to help with the camera system, but if you said, you know what, the PPE is something we can emotionally tie into as well and feel good about, and your constituent as well, that would be a significant contribution as well.
Okay, thank you. David, can you thank them formally, please?
Ron, Wendy, and Tony, thank you very much. We really appreciate hearing from you. My family's been involved with palliative care, and a lot of what you're talking about is that, you know, just keeping people comfortable in those circumstances. Shepherd Village is a wonderful facility. I mean, I've been there. I've seen the way people interact. I've had lunch there several times. Food's pretty good. So thank you so much for filling us in on this, and we hope that we will hear updates from you in the future, and we'd be happy to, through Arthur and his team, to have a look at what and how we can help with. Okay.
Thank you so much for having us.
Thank you, Ron. Thank you, Wendy. I guess you got to go now. So
okay. Thank you.
Bye-bye. Thank you.
Bye now.
Thank you.
Tony, you hanging around?
I'll hang around just for a few more minutes, but yes, I've got to go to work as well. So
okay.